The goal of an OT is always to optimize a person's ability to engage in meaningful activities. Occupational therapy is rehabilitation science, so it means that it's designed for people with injuries or illnesses, and it can help individuals of all ages. It requires a master's degree and a professional license that must be renewed annually. Occupational therapy is also regulated by a professional order that ensures the quality and ethics of the practice. In occupational therapy, we focus on daily tasks, leisure activities, and productivity, essentially all the activities that give meaning to a person's life or bring them pleasure. So we don't just use meaningful activities as a goal in therapy, but also we use them as a therapeutic tool because we know that engaging in activities can help improve our well-being, and in some cases, we can use it as a distraction to cope with pain. So like I said, if there's something you'd like to do, but you find it too difficult because of migraine or because it triggers episodes, an occupational therapist can help. Here on my slide are some detailed examples of activities an OT can help you with, just to give you a clearer idea of the range of support available. OT can support you in improving your condition, but also in adapting to life with migraine. For example, an OT will help you identify triggers and also to adapt tasks and your environment so you can engage in activities more easily, even during a mild episode. This way, you can continue participating in meaningful activities while respecting your personal limits. For those with frequent or chronic migraine, accomplishing as much as before in a single day often becomes impossible. So OT can teach you energy management strategies to help you not just with one single activity, but to organize your entire daily routine to better balance your energy.
Annie, I'm sorry to interrupt. Your slides seem to be stuck on
You're
your
right.
first slide here.
I'm so sorry. I'll do this here. Okay.
Okay, yeah, it's changed.
Yeah. So that was where I was talking about the goal. So always to optimize the capacity in meaningful activities. So sometimes it's difficult for people to understand what is really occupational therapy because it's a broad approach. So it's hard to specifically understand what it's working on. But what you need to remember, it's really that the goal is to help you to be able to do an activity you cannot do anymore or that is difficult to do. And the therapy is going to look at all the aspect that can influence your ability, like here it says on my slide, like physical, neurological, sensory, social, mental, and cognitive health. But the therapist is going to do the work. It's just so you understand that it's really a broad approach. We can work on the person, like if you need to be in a better physical shape, for example, but we also can work on the environment to adapt some part of it so it won't triggers an episode, for example. And there was the example, so the details on all the different activities we can work on. Well, it's all the daily activities you have, as simple as washing yourself, or and more complex like going to work or to drive a car, for example. Yeah. So next, let's dive deeper into what an occupational therapist can do for migraine treatment. So as you may know, the optimal approach to manage migraine includes medical follow-up, often with medication, and self-management. So this is where OT plays a key role helping you with the self-management aspect. In fact, occupational therapy covers most areas of self-management for migraine, but particularly by supporting you in integrating and maintaining these strategies in your daily life. Because let's be honest, this is often the hardest part. Knowing what to do is one thing, but actually making it part of our routine is another. For example, we may understand the theory behind adjusting our sleep to improve migraine, but implementing it can be challenging. It's similar to quitting smoking, starting a diet, or getting back into exercise. So now let's break down here how an OT can contribute to both the preventive and acute treatment of migraine. So on the preventive side, as I mentioned earlier, an OT can help you identify your triggers. And if you choose so, she can also guide you through gradual exposure to certain triggers to reduce your sensitivity over time. This approach is scientifically proven to be effective, but it's difficult to do it on your own because it can create stress. So it's good to be support in that. NLT can also teach you all the scientifically backed migraine protective lifestyle habits, including strategies you may know around sleep, diet and hydration, stress management, physical activities, and posture. Additionally, they can help with energy management and environment adaptation so you don't push past your personal limits, which can contribute to trigger an episode. All of this will be tailored to your personal situation with recommendation of specific change to implement in your daily life. For example, your therapist won't simply tell you to optimize your sleep or give you a list of everything you can do to optimize your sleep. Instead, she's going to review with you your weekly schedule, including the weekends, and you may decide on specific wake up time and bedtime hours that would work best for you. So, really, she's going to do the work with you to find how to adapt your sleep so it's going to be better for your migraine condition. And your job's going to be to try this for the following months and see if it has a positive impact on your migraine. That's it. The therapist is really there to help you pass from the theory, sorry. So from the theory to the practice. And then how does an occupational therapist can help you manage your migraine during an episode? So the occupational therapist may help you recognize your prodrome. So um, maybe you don't know this term. Well, it's the first phase of a migraine. So it's the warning signs that an episode is starting. So when you can recognize this phase, you can adjust your task to avoid worsening your symptoms. This can help prevent an episode from escalating into a severe one. And they can also help you find alternative ways to carry out essential activities during mild or moderate episodes. And OT can teach you also strategies to soothe symptoms during an attack, such as using distraction techniques, relaxation methods, emotional regulation strategies, or self massage. So just a reminder that OT works alongside with your medical treatment. It's really complementary rather than replacing it. And I would advise that you don't start OT alongside another therapy at the same time because it can become overwhelming since OT is really a broad approach addressing various aspects of your life and daily routines. It's best to start when you have not much on your plate and enough mental space to focus on making changes. And then your OT can guide you uh, or refer you to other professionals based on your specific needs, such as nutritionist, psychologist, social worker, or rehabilitation counselor. So So what to expect during an OT follow-up? Well, the first session will be about, will focus on the evaluation. So during this stage, the OT may conduct interviews, ask you to complete activity log or review your schedule to better understand your daily routines. They may even put you in some task simulation to observe how you perform your activities and the challenges you encounter. So I would advise if simulation I would advise that you do so in your real environment, so at home or even at work, so the OT can have a complete understanding of your situation. Because like I told you, we can sometime we can act and change things in the environment. So if we don't see the real environment in which take place the activity, it's more difficult for us to help you. So if it's possible for you, it's better to be in your real environment. Um, Regarding session frequency, I recommend starting with one session per week. This allows the therapist to get to know you better and to define your specific goals with you because, like I said again, it's really a broad approach, and we cannot work on all your daily activities at the same time. So we're going to have to prioritize. So the first sessions are good for that. And then when you're going to have some recommendation and you're going to have to start applying them in your daily life, then you can space the session. You can go like one per 2 weeks or even once a month. So you have time to implement the strategies at home. This way, each session is going to build on the real life adjustment you're making, ensuring the change are practical for you and sustainable. In the following sessions, DOT will work with you on various techniques suits to your specific needs, such as pain management, stress relief, or social skills, as previously discussed. For example, I like to give you examples so you really understand what we can do with you. If you find it stressful to talk to your family, colleagues, or your supervisor about your migraine, and you don't know how to approach conversation, well, the OT can help through role playing and simulation. So this way you can determine what you want to say exactly. You can practice in a safe place before having it in real life. So you're going to feel more prepared and confident. The result you can expect are reduced frequency or intensity of your migraines, improve mood, increase in your functional capacity, and enhance overall quality of life. Change that. Yeah, so here are my key tips for migraine. As I explained in occupational therapy, our expertise is daily life. So in addition to my knowledge of migraine management, I've put here the key tips for you. You can integrate at home. That said, don't try to implement everything at once. It's going to be too difficult. It takes time to change habits. So take your time, but I wanted to leave you with concrete advice here that also illustrates the types of change you might work on in an OT follow-up. But OT is really more than that. If you I just want you to remember if you have an activity you cannot do anymore and you wish to take it back, so the OT is gonna help you with that directly. Here is more like general tips for everyone. So for sleep, try to wake up at the same time every day, even on weekends. Sometimes that's difficult, but poor sleep is one of the biggest migraine triggers, and improving your sleep habits often bring the most noticeable results. Also, if you snores, consider getting evaluated for sleep apnea, as it can worsen migraine. For nutrition, eat at least 3 meals a day, and if possible, include 3 snacks, all of which should include protein. I often hear people, and I've been there myself too, that wake up with an episode. So if so, it may be because, we're fasting during the night. So you can try to take a protein and fiber rich snack before bed, like vegetables and nuts or vegetables and cheese, and see if it's helped. You're gonna have to do this at least like for, let's say, 1 month, but it's better to try every new strategies 3 months to really see if there is a difference in on your calendar, your migraine calendar. Hydration, well, I think I won't learn you anything there. You need to drink throughout the day, but it I want to precise that it's important to drink small amounts throughout the day, rather than large amounts once in a while, because your body cannot absorb large amounts all at once. So you're just gonna eliminate it and go to the toilet. So it's not great for it's not great at all. And then relaxation, that's one of the best thing to do when you have migraine, because migraine is really like inflammation in your brain. So your brain needs to be soothed and to be calm. So relaxation technique is the best way to do so. And really, there's nothing better than another. There's plenty of relaxation techniques, and choose the one you love. It can be different kind. You can change by your feeling of the day. It doesn't matter. Try everything you want, and if you find something that suits you, perfect, stick on it. It can be guided meditation. You can have a mindful walking. You can even do relaxation during an attack. Personally, I found that focusing on how pain fluctuates when I have an attack can make it feel less overwhelming. So that was a big discovery for me. The first time I meditate on pain, it was a guided meditation. And initially, I thought of my pain as a static and sharp point right there, like a knife in my head. But when I practice relaxation during an attack, I notice that my pain move and change over time, like in the same minute. So that was really a surprise for me. And this small realization made a huge difference for me, because it felt less like enduring a rigid, unbearable pain. And it was more like learning to move or dance with it, because it was fluctuating like this. So try it and you'll make your own discovery, I'm sure. What else? Physical activities. Uh, I think that's the other best one. The most important thing there again is to choose activities that you enjoy. It's really the key. So you're going to stick with it. You can have a variety of it again. It doesn't matter. Yes, science suggests doing light to moderate intensity exercise for 40 minutes, 3 times a week. They really demonstrated it was helping migraines. But let's be realistic. If you're not able to do this tomorrow, don't go there. Start from where you are. That's 20 minutes. That's great. Any movement is better than none, and it can make a real difference in your mood, your sleep, your energy, your posture, all those things that you need to help with migraine and your overall well being. So, a good rule of thumb is that you should still be able to hold a conversation while exercising, and once you stop, you should feel fully recovered within an hour. If not, if you feel completely drained after a workout, chances are that you're pushing too hard. Physical activity is meant to give you energy. If I take again my personal experience, I'm this kind of person that always go over limits. And maybe that's one of the reasons I have migraine to stop me. So when I accept that I should um, how to say, to slow down in my physical activity level. At first, I thought it would be too easy and not worth it. And I realized the good effect it has on my mood, just to name one. And it was enough for me to stick with it and not waiting to see if it's going to have an impact on my migraine. Now, let's talk about energy management. I can talk about the Pomodoro technique in the Q&A part if you're interested. But here, my advice would be to plan your schedule with plan A, B, and even C. So let's say on Monday mornings, you'd like to clean the house for 30 minutes. On the first Monday, you don't have an attack. Perfect, great. You can go scrubbing the bathroom. But on the next Monday, you still have the same schedule of cleaning the house for 30 minutes. But this Monday, you have like a mild to moderate attack. So that's where Plan B kicks in. And you decide to dust the living room because it's easier than scrubbing the bathroom. On the next Monday, for example, you have a severe attack. So you go with Plan C and you turn on the robot vacuum and you take a break. So the same applies for exercises. Maybe your goal is 20 minutes of physical activities every morning, but on migraine days, you can switch to gentle stretching instead of skipping movement altogether. Now, something that happened to almost everyone, myself included, is when we cut out enjoyable activities because migraine becomes frequent. More frequent. So, work, household responsibilities, taking care of family, those still get done. But our hobbies, our social time, they're the first to go. And that has a major impact on our mood. Studies show that when mood declines, preventive migraine treatments become less effective. So you should have a look on your schedule to be sure that you have time to feel pleasure and have fun. In the same subject, sometimes we need to make people understand myself first. When I was uh, when I was becoming chronic, you have to stop waiting to feel better before resuming activities that matter to you. If something no longer works for you, you can adapt it with an OT, for example. You need to find new ways to engage in what brings you joy or discover a new hobby. Your well being doesn't start when your migraine gets better. It has to start now. It's working the other way. Your migraine is going to be better when you feel, when you're nourish your well being in your daily life. It's not the only thing that you need to do. Like I said, medication is important and everything, but like the study shows, like I told you, if your mood is really bad, if you have a mood disorder, for example, it's related a lot with migraine. It's the treatment's going to be less effective. And finally, I talk a lot on those slides. I like to give tips. There's a common misconception. Many of us feel we have to choose between, on the one side, trying to cure our migraine and we wish to reduce the frequency to find the right treatment. And on the other side, accepting it and learning to live with it, to adapt to it. But in reality, these two aren't opposites. You don't have to choose. Sometimes when you're out of work, you have your insurance company asking you, are you going back or not? And they put you this pressure to choose, um, will I be um, will I be cured one day and be able to go back there, or should I accept that I won't be able to go back and change completely my career? But you don't have to choose. By adapting your daily life right now and setting realistic expectation, including activities that make you happy, You're not just learning to live with it, you're actually creating the best possible condition for improvement. It's the same way to have both adapt to your illness and also try to heal it. Yeah, that's it, to heal it. So I hope this is clear. If not, you can ask question. It's going to be a pleasure. And finally, my last slide is how to find a practitioner for migraine treatment. So here's is the tricky part. There's no specific OT specialization for migraine, like in a lot of other professions. And unfortunately, if you check on OT regulatory bodies, you won't find a search filter for migraine management. But don't worry, OTs are trained as generalists, meaning they can support you based on your symptoms and your challenges rather than depending on your diagnosis. So here's what you can do. When searching for an OT, focus on the areas of practice that align with your needs. For example, here I write a list of different area of practice that we have on the regulatory bodies of Quebec, OEQ. So, for example, if you have a lot of sensory hypersensitivity, if it's a major issue for you, you can look for OT specializing in sensory integration and processing, for example. When it comes to energy management, like I mentioned a lot of time earlier, that's actually a well-known topic for all OTs. So regardless of their specialty, they can guide you in balancing your activities without triggering more attacks. So where can you start your search? I would advise the CAOT, so the Canadian Association of Occupational Therapy, that has resources to help you find an OT. And also you should have a look on your provincial OT regulatory body where therapists are listed by their area of practice. It might take a bit of digging at first, but you'll find someone who can help you navigate with migraine management.